ladies and gentlemen, and welcome to another Manual Monday. Today we're going to be discussing stress headaches or migraine headaches that are caused from posture, which are the most commonly occurring headaches that we know of, right? So a lot of times we're dealing with these things and they're frequent and reoccurring, and people get treatments such as Botox injections and other medical interventions that involve medication, and things that are really should be a last line of defense become like a primary treatment source. So what we want to do is clear the air and talk about the first line of defense, which is improving the posture, calming the soft tissue structures that are overworked, and then facilitating a sharing or distribution of the load of the upper trunk, the neck, the shoulder blades, the muscles that influence the posture that help to relieve the tension and the stress in the suboccipital region, which help eliminate stress headaches or headaches that originate in the suboccipital region of the head. So I think you guys will really enjoy this video. Today we'll start off with some manual techniques, and on Wednesday we'll come back and we'll address some therapeutic exercises and some different type of stretches and techniques that you could do at home to help yourself. I hope you enjoy. The anatomy of the cervical spine, the thoracic spine, and the shoulder girdle is very complicated and it's very complex. There's a lot of moving parts that serve functions that are shared, and some of the functions are static in nature where they're just supporting our posture and our spine and our trunk position. Some of the muscles are involved in movement of the shoulder girdle and the limbs, as well as the movement of the head and the neck. So when addressing stress headaches, you have to be very broad in the range of things that you're addressing, and starting in the lower thoracic spine and the shoulder girdle and working your way up into the head and neck is generally the best idea because it's the foundation of the head and neck. Here we're providing a suboccipital release. This technique puts pressure on the suboccipital muscle attachments, and with sustained pressure and breathing techniques, it does a really good job at releasing tension from that suboccipital attachment. Here we're providing the same technique, but now we're doing more of a mobilization of the sacral. This is considered craniosacral therapy, where we're really focusing on the cranium's position on the first cervical vertebrae. Now we're transitioning into cervical protraction and retraction manually, where we're mobilizing that cervicocranial joint, that first C1, C2 vertebrae, atlanto-occipital joint. Now we are transitioning to lateral glides, where we're working from C7 all the way up to that atlanto-occipital joint bilaterally, and this is also a good assessment tool. Now we're doing a stretch to the upper trap and the levator scap musculature on the lateral sides of the neck. And now we're transitioning to a pec minor release, which is super important because this binds the shoulder blade forward and really harms the posture. This is dry needling technique, where we're actually inserting needles into the suboccipital muscle attachments. And then we will also come down into the upper trap attachments. That way we're kind of serving the neck and the shoulder girdle. And then we will come back with stimulation to calm and to help reset the musculature involved. Now I'm performing posterior to anterior mobilizations of the thoracic spine. Again, as you can see in the anatomical model from earlier, that a lot of the musculature involved spans from the thoracic spine up to the cervical spine and even to the base of the skull. So it's really important to mobilize that thoracic spine and to keep those joints nice and loose. Now we're doing some cupping therapy, which is a myofascial technique. And what we're doing is providing decompression to the tissues that are involved in supporting the posture. And this is also it's influencing the pressure gradient, which is allowing fluids to transfer to break up some of the tension in the connective tissue in the upper back. And I'm stretching these cups out to provide additional myofascial stretch. There you have it, another successful Manual Monday, and I hope you guys enjoyed seeing these manual therapy techniques that we use here in the clinic. We enjoy doing these videos because it gives a little insight into the stuff that we do here on a day-to-day basis that the general public doesn't always get to witness. So I hope you guys enjoy this, and tune in for Wednesday's video where we'll do some therapeutic exercises and techniques to follow up with our migraine headache, our stress headache treatment plan. See you then.